Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome everyone to our podcast today on Quran and mental health. And here I have with me resident physician Dr. Badeea Qureshi, who also is my wife. And we are going to talk a little bit about some of the things that people have been discussing around mental health and how that can connect with our faith. It was prompted by we wrote some articles for our blog on Quranic, and the most popular article in Ramadan was what's the best English translation in the summer? It was verses in the Quran about marriage, and now in the fall, it's verses about depression and sadness and stress. So
The
uh,
seasonal depression is
seas-
kicking in,
seasonal
and people
depression
want
is
to know.
kicking in, and people want to know what the Quran has to say about that. So that's kind of what prompted us to say, "Hey, let's start off with this podcast." So should we jump right in, or did you wanted to introduce something?
No, no, we can just go for
Okay.
it.
All right. So the first question we got, so we asked, Badia actually has quite a bit of a social media following. Um, uh,
Hardly.
a little bit, enough that we were at IKEA and someone approached her and was like, "Oh wow, you're I follow you on Instagram."
It happened one time. Clearly, it impacted Adam more than it impacted
No,
me.
it impacted you. I'll tell you
Yeah,
that.
yeah, I was really chuffed. I was really happy about it.
So anyway, so we asked on her social as well as the Quranic social media pages, what are some questions people have around the Quran and mental health? And the first kind of most common question we got was, is depression a sign of weak faith? So what do we say about that? Is depression a sign of weak faith?
But we're going to start with the, what is mental health overall as just a topic or as a question?
You want to go back and do that first?
Yeah.
Okay. All right. So the first thing we wanted to talk about was, what is mental health? So what do we mean by mental health and Quran and mental health? So what are your thoughts on mental health?
Well, first of all, it's a really big question. Like, what is mental health? But if you do a bit of Googling, you'll see that, there's concepts, especially in CBT therapy, cognitive behavioral therapy, about, our mental health being a combination of our thoughts and our feelings, and that like translates into our behaviors. So yeah, you can look at it like that. For me, what I think of it like is like something like a combination of all of those things. Like if you bring them all back together, what does that really mean?
So your thoughts, your feelings, your emotions.
Your behaviors as well,
Yeah.
like how that translates. But if you bring it all back together, it's kind of like the internal dialogue that you have.
Mm-hmm.
Um, like the way that you are inside of your own head, the way that you kind of talk to yourself or about yourself, or the way you process the world around you.
So mental health is neutral in and of itself,
Yeah.
and it can be positive. You can have good mental health, or you can have bad mental health.
No, I mean mental health is it's kind of like physical health. It's like a tool that you need to be able to like, navigate the world. And sometimes illnesses can arise, with various like receptor imbalances and neurochemical neurotransmitter imbalances, or if you kind of like really pay attention to your self-care and the maintenance of your health, and then you've got mental wellness,
Mm.
so it is kind of a neutral thing. It's a tool, right? Just like your body's a tool, your mind is a tool. Sometimes it can malfunction, sometimes it can function really well, and just it is what it is.
Okay. And I guess on top of that, how do you take care of your mental health? How should you take care of your mental health?
There's 100 different things that I mean that's too big of a question, really, isn't it? But just being able to like talk about it, being aware that I'm in a bit of a funk right now. I'm not really feeling quite like my best self right now. I'm not in this context on this like podcast. We're kind of talking to the average Joe who might need a little bit of fine tuning of their mental health.
Yeah, I think for a lot of people, I think in psychiatry. So a lot of people don't know what psychiatry. My dad calls you a psychologist, right? He doesn't know the difference between psychology and psychiatry. But with psychiatry, mostly you're in the hospital and you see very acute cases, very severe cases, where someone has attempted suicide, someone is having a bout of psychosis or schizophrenia where they can't, their life is not under control and they need a lot of help to where they're coming to the hospital just to get back on their feet. So those are very severe cases, which most people don't fall under that, right? Most people, when they think of mental health, they're just thinking of sadness or seasonal depression or, man, it's dark outside, so I'm feeling a bit not as happy as I was in the summer.
Yeah, to be honest, actually, it's your PCPs, like your primary care practitioners, who see the most mental health because they're seeing like loads of routine patients who come in for so many other reasons who also have mental health, factors. The things that psychiatrists see are pretty kind of like high level, niche, very difficult situations.
No.
By the time you've arrived at a psychiatrist, there's a bunch of stuff that's happened.
Yeah.
You know.
But so for the purpose of our discussion, we're focused primarily on like what can be relevant to the majority of people.
Yeah.
For now, at least.
Yeah.
For now.
For now, yeah. We'll see how this goes.
We'll see if we want to get into some of the more interesting topics that you've been researching recently. So
Stay tuned.
for the basic average Joe, average person, average Zaid instead of average Joe, what does it take to take care of your mental health? How do you go about doing that?
Like I said, like breaking down some of the taboos around it, feeling able to talk about it, feeling able to talk, like name your own emotions and say that out loud, is probably a good first step. Obviously, I think everybody should be in therapy, literally every single human. So that would always be a positive to help you kind of like uncover more of yourself, which is incredible process. So if your health insurance covers it or whatever, then definitely like go for it. It's worth the time.
Yeah, I mean, health insurance is particular to America. It depends where you live. So our audience is pretty global. So
okay, well, if you can make time for, and you should try and make time for therapy, then you should go for it. And I don't know how prevalent therapy is like globally, but in the USA, it's becoming more and more kind of an acceptable thing.
Yeah, I think especially like in the Muslim community, therapy is kind of like what? Like just go pray, right? It's like if you're feeling sad or you're feeling depressed, the response you might hear, some people might say is, well, you need to connect to Allah. You've lost your connection to Allah. That's why you're feeling sad. That might be something that you hear. Or it might be that if let's say you went to your parent or an older relative and you told them you were feeling sad or depressed, they might say to you, they might feel themselves that they failed in some way. Like your parent might feel that have they not raised you properly? Have they not raised you to be a strong person? So they might even take that personally. And then that's where that comes from. Well, oh, it's because you don't do what I tell you, and I always tell you to pray, and you don't do that. So,
like, I'm a good parent. I tell you to pray, but you don't listen to what I say, and therefore the fault is on you.
Therefore, you're sad, and now I am telling you that it's all your fault.
You are sad, and it is your fault. And I will not accept any blame in this process.
And it sounds, it's kind of...
And why do you need to go and talk to a human being, random therapist, when you can just go and talk to Allah directly, right?
And you can talk to Allah subhanahu wa ta'ala, of course you can.
We're not discounting that.
We're not discounting the importance of routine, of salah, of all those things.
Spirituality.
Of spirituality. Of course, there's so many studies that show the importance of spirituality. And so many of the modern therapy methods that Badeea and I talk about that she's studying as a resident are based in the spiritual realm. They're based on practices within Buddhism and other kind of religions. So spirituality is a huge part of mental health. But if you're sad is the main solution to praise Allah, there's other things to do as well. That sometimes it's faith related and sometimes it can be something completely different. Or it's a mix of the two rather. So we'll talk a little bit more about that today. So getting to the first big question related to this idea of someone telling you to go pray salah and it'll fix your your depression. What do you have to say about that?
You know, it's just, I mean, when people say things like that, it's because they're not really understanding what's going on, and you know, people aren't educated about these kind of things, and they've not grown up like knowing, understanding emotion, mental health. It's all like a thing that's becoming, you know, is gaining traction
No.
more
Yeah.
and more now.
Yeah.
Yeah. Although there's incredible Islamic legacies in mental health, and loads of contributions there from Muslims, and you know, I'm digging more into that history as well, because I think it will help to break down some of these barriers. Like, actually, it's not foreign to us talking about mental health, and we all talk a lot about spirituality. We're comfortable doing that, you know, and it's a big aspect of our mental health. But when you dig in a little bit deeper, it's like, okay, whoa, we don't go there, you know.
Yeah, I mean, one of the first psychiatric hospitals ever recorded was in Baghdad, was in Iraq at the height of Islamic civilization. So this was something that the ulama, and because there's many ulama who are famous today for their Islamic contributions to Islamic studies and law and Sharia, they were also doctors. Ibn Sina, Ibn Rushd, right? I studied Ibn Rushd in school for my comparative kind of Islamic law, comparative fiqh studies, but he had also written a manual to medicine that was widely used in Europe for centuries. So there's a lot of overlap there, and this was an important part of our history. So getting to the question, is depression a sign of weak faith?
I would say no.
Okay, so there you have it. That's the answer. We don't need to go into why.
No. No, there's 100 different reasons that people might fall into a depression. It might be a 2 week long. Well, it has to be at least 2 weeks long to even be really like diagnosed
So
with
you
major
feel
depression.
sad for 2 weeks.
It's not just sadness though, is it? Like, if you think about the criteria, the DSM-5, which is our little diagnostic manual in psychiatry, you know, the criteria involves being the anhedonic. It means like that you don't find joy in anything, in any of the things that you used to enjoy. Your sleep pattern might be off, your eating schedule might be completely off, you might be just so lethargic, no energy whatsoever, completely like flat affect, and not able to really even smile, and you know, it's very debilitating.
And where does that usually result from? Where does it come from, that kind of depression that's, clinically depression?
If you ask people like what, I mean,
What leads to it?
there's a bunch of different things, you know.
Yeah.
I don't know, have you had a bereavement recently and it's kind of sent you into this
A sudden loss.
A sudden loss.
Death, divorce, something like that.
There's 100 different things, and you know, sometimes it might just be a neurochemical balance problem that you couldn't have foreseen, or it might not really even be related to like your social circumstances. We've got like the biopsychosocial model of trying to figure out why things happen to people and how they've happened to people and how all these things contribute to your mental health. So like, what's your biology? What is the psychological aspect of what's going on with you? What is the social implications of what's going on with you?
And you could even add spiritual to that.
Add that, biopsychosocial, spiritual.
So like, if you have like all of those factors can add to it. So if your physical health is not doing well, that's your biology, right? If you socially, like, you maybe feel lonely, or you don't have a lot of friends, or you don't have people that you can count on, or you feel betrayed by someone close to you, all
even
those things
like,
can
you know,
lead to
socially, like job loss, financial issues, and you know, relationship issues, and housing issues, and poverty issues. Like, there's social
many
is a
different
big one.
things.
Yeah.
Social is such a big one. Okay, wow. So all of those things can lead to a state where you feel like that clinical depression. So then what should you do? What is the way out of that for a person? When someone is said to pray salah, then you're putting it solely on them and their connection to Allah as to why they're in the state that they are. But there could be so many different things, as you've mentioned, that lead to that.
And honestly, the way out of it, in my mind, is to see a doctor and let them know that things are really rough, and they'll diagnose you with clinical depression and consider starting some medications for the time being. And it's not something you should really shy away from, because being in that kind of state of clinical depression, it's dangerous.
Mm.
Suicidality and those kind of,
Yeah.
intrusive thoughts about suicide like skyrocket. So
And that's a big one because, recently there was a study that showed that Muslim youth are twice as likely to attempt suicide. So it's definitely like an issue. People that I talk to in the community, therapists and so on, they say people come to us when it's basically too late. When the attempt at suicide has already happened, something so drastic has happened. Well, now it's like, now let's seek help. But really, there's a preventative factor here that people need to get into.
Yeah, preventive in terms of like, you've got the depression, let's sort it out before it gets to a point of, really, really dangerous.
Yeah.
And to be honest, at that point, you can't really be held accountable for what the heck is going on. Lots of people kind of have really negative views of suicide and how can somebody be so selfish as to commit suicide? And actually, when you're in a state of depression and you're basically debilitated, your mind is truly like, you don't feel like yourself at all. Islamically, there's the concept of there's like three criteria that you're not held accountable for what you do, and that's like if you're a minor, if you are sleeping, or if you are insane. And the definition of insanity is not like a medical definition, it's a legal definition that exists in like US common law and also in Sharia law. So the compassion needs to really go up when we're talking about suicide and suicidality, and I think that we're probably not really mature enough yet.
So getting back to the depression issue, right? The idea that is depression a sign of weak faith? I think I'd like to challenge that from my perspective, being trained in Islam, that there were times when there was sadness in the biography of the Prophet, right? We have Am al-Huzn, the year of sadness, where the Prophet was had lost his wife, his dear wife Khadija, his dear uncle Abu Talib, who was his sole kind of main human protector. And Khadija being his human support. Of course he had Allah. Of course he had Allah's protection. Of course he had Allah's support. But those two humans who he lost in the seerah that year afterward is called Am al-Huzn, the year of sadness. It was after the boycott of the Hashimin. It was after the boycott of the Prophet's tribe that led to such economic, right? And all that stuff, right? The social, their bodies were weak, the physical, all of that was combined. Am al-Huzn, right?
And what that did to their psychology as well.
What that must have done to their psychology.
They were part of a community, and then they were being like isolated.
Isolated, yeah. So all of that is there,
yeah.
of course. So you have Am al-Huzn. You have also...
You have the perfect storm for every type of like psychological issue to arise, a psychiatric issue.
Yeah. So you have the Am al-Huzn, and then you have the second thing, yes, of course, you have another example is the Prophet, peace be upon him, when he lost his son Ibrahim. When he lost his son Ibrahim, he was sad, he was crying. And one of the companions said to him, "Are you refusing Allah's decree?" Not in an accusatory way, but in a questioning way. That the idea being that, when we cry, it must be because we're upset at what Allah has decreed to us. And how can the Prophet be upset at what Allah has decreed because he is the Prophet? And even though he suffered such a huge loss, he should never be upset at Allah's decree. And so that's where the question came from, is can we refuse Allah's decree? And the Prophet ﷺ's response was along the lines of letting him know about the reality of emotions, of human emotions. This is not something that you control. This is not something that it's your fault, right? He said, "Inna al-'ayna latadma." Truly my eyes, they tear up, right? There's no I am refusing Allah's decree there. It's the loss of my son, right? It's the loss of my son that has led to this. So here's some tea.
Take some cold tea instead. Thank you. Sorry about that.
Okay, so as I was saying, the Prophet ﷺ loses his son. He grieves over his son. He has strong emotions over his son. So that cannot be said. It cannot be said that that's a sign of weak iman. Of course not. He's the Prophet. His iman is strong. So for someone to say that just because you're sad or you're grieving, whether it's over the loss of a person or a loss of something else in your life, right? The loss of control in your life, the loss of some property in your life, some kind of finances, economics, socially, right? All those things that we talked about, physical health, the loss of any of those things that leads to this sadness.
Yeah, it's just interesting to me as well that, if you're not kind of like stone-faced all the time, then people assume like something must be wrong with you, or you're dissatisfied, or even a small expression of some type of emotion is like, oh, what could be going on, And actually, we're not stone-faced people, We're very expressive, and muscles of expression on our face are like, you know, so,
Yeah.
we're allowed to show expression.
Yeah.
It's okay.
Yeah.
It doesn't mean that you're going to crumble into 1,000 pieces any second. It's just being human, right?
Yeah. So that was the first thing I wanted to mention, which was the Prophet's own life. And the second thing is, let's go into a little bit more about medication. So you feel sad, right? And although you've given us some of the things, of course, to get a true diagnosis, you can't self-diagnose. You go to a doctor and they kind of confirm that this is what you have, or this is what's wrong. Based on whatever questions they ask you, they know what that is. So once you get that, then they give you medication. So how it is something, I mean, people might find that strange in the Muslim community. I'm taking a medication, which is what, messing with my mind? Doesn't alcohol mess with my mind? Marijuana messes with my mind? Those are intoxicants. So something that's messing with my mind, number one. And number two, how does something physical that I'm putting into my body, how does that affect my mental health? How does taking liquid affect my mental health? So both of those things, if you can say in a layman's terms, of course, yeah.
First of all, when people use alcohol and they use various other psychoactive kind of recreational drugs, for whatever purposes, then it's kind of a different thing. Like, you're probably, in your normal state of mind and you're dabbling in various drugs for whatever recreational purposes, right? When you're going to a doctor because you're actually depressed, and you're maybe needing medication, your mind is already like not really your own. Do you see what I mean? You're already like really struggling. So it's not like you're deviating and using psychoactive substances recreationally to like deviate your mental status. You're actually trying to bring it back. Do you see what I mean? You're actually trying to recollect and basically, especially with antidepressants, which are really useful medications, the ones that we use most frequently, or most commonly, would be the selective serotonin reuptake inhibitors, SSRIs. These basically work to increase the serotonin levels in your
What's serotonin?
brain. It's a neurotransmitter. You can consider it to be like a happy hormone or like a happy chemical,
So these medications, essentially, they increase your happy hormones, and they get you just enough so that you can pick up your pieces a little bit, get yourself on the right track again. It's not something that's necessarily meant for you to take for life.
No, not really with antidepressants. Some people, it really depends on circumstances.
Of course, it depends.
Yeah.
But what's the most common thing that you see, right? This is a very
The most ideal thing is what I'll say is that, if you, your mental health is lots of different factors. You need your medications, you need your social support system, you need your physical activity, you need therapy, psychotherapy. So with all of these factors combined, then you should be on a trajectory to improving. And then we can start peeling away the medications, peeling things away, taking off those, what is it called when you're...
Training wheels.
Taking away the training wheels a little bit, and you might feel like yourself and feel able to. But it's not uncommon for people to be on antidepressants for a year, for 2 years, and keep checking in with their doctor, and together making a collaborative plan of like, I think I could.
So it depends, right? Like the answer is always it depends.
It depends on the individual.
It depends on the individual.
And I think,
but I think it's interesting to know what the normal kind of process looks like.
Yeah.
Of course, it might differ from person to person, but just an example for those of us who probably have no exposure.
Yeah, well, the biggest
to that
thing
kind of stuff.
to remember, because I think like when we go to the doctor, we think, right, we're just gonna have to listen to the doctor. Whatever the doctor says, we're just gonna have to do. But actually, like, your treatment plans are made in collaboration with your doctor. Do you see what I mean? There's no way that you will do anything that you don't want to do, you know. But it's important to bear in mind that this person you're talking to has expertise. And you know, you're going to a consultant basically, and they to consult with them about your mental health, because you just could never know. You could never know. You don't have the skills, you don't have the tools, you don't have the knowledge. So it's okay to consult with somebody about it, you know, and realize that what they're telling you is probably something that might be good for you, you know.
And I think that goes along with the Islamic obligation to seek cure, right? If you're sick, seek cure. The Prophet ﷺ told us that every illness has a cure, so seek the cure. So that's something that we should do not only for our physical ailments and physical health, illness, but we should also do it for mental health and for mental illness, right? But I think there's just not a lot of, there hasn't been, at least traditionally, hasn't been a lot of exposure to mental illness. There hasn't been a lot of understanding of mental illness. So talking a little bit about the science of it helps to understand that a little better. Now, the next kind of question we got from folks is about family members. Is that if I have a family member who doesn't understand, well, on two sides. One is you see someone who's sad, right? You see someone who's depressed, who's kind of going through some things. How do you support them? That's on the one hand. On the second hand, you have, if you yourself are feeling that way and you're trying to get support from others and you're not finding that support, what can you do there? So it's like the two ways, right? So going to the first one, which is you see someone who is depressed, is sad, is not on their not their normal self. What do you do? What can you do?
Well, you know, my mind's still kind of lingering on the last question, just about like trust with the medical system and things. But anyway, we can talk about that another time. So the way to support somebody who has you know, who is struggling with mental health, the best way, first and foremost, honestly, is just to go and listen to them, to create space for them, and literally zero judgment, just listen without without trying to work out what your response is going to be, without trying to come up with a solution. No, just like absolute attentive listening and being present. And I know this sounds like proper basic, but it's actually really hard, and it almost goes against our intuition of wanting to fill silences, wanting to be helpful and come up with solutions. And you know, so to actually just sit with someone and say, my God, I can see that you're struggling, and notice in yourself that you're probably going to feel a reaction too as well. You might feel some kind of discomfort, you might feel a bit sad yourself, and being in that emotion and noticing it inside of yourself and sitting with it and sitting with that person, rather than trying to solve it and cure your own anxiety and, you know, come up with quick.
So on one side you have the listening, right? I gave a khutbah on this called "How to Give Advice."
Oh, link it.
Quick plug. So that's the one side, and the other side is kind of the physical support, like maybe to delivering food to them, or you know, finding them the therapist that they need to get out of the situation, or helping them to get back to routine somehow. Right? Those are also things that you can do to support someone who's going through that, because when someone breaks down, my understanding of it is that a lot of things in their life break down. They're not able to take care of themselves. They're not able to do a lot of the things that normally all of us do, like shower. And I remember you told me about, you know, people who couldn't even go to the bathroom. They wouldn't even make it to the bathroom, right? That was in such a situation that they weren't even able to go and make it to the bathroom, right? So I mean, that was a severe case, but at least for the more mild ones as well, is how can you help them get back to their routine? How can you support them?
Yeah.
Is that true?
And it's not like pressure to get back to your routine and things. It's kind of just like, look, I'm here. First of all, you're an active listening ear. You know, you're coming from a place of warmth and genuine concern. And secondly, like those needs, obviously, anytime anybody's ever brought me food, and when I was pregnant with my 2 babies, lots of people did bring me food, I swear to God. Until today, I make dua for those people. You know, like it is such a big when you're depressed, when you are literally feeling so sad
Mm.
and you're basically debilitated by it, cooking food is a really high functioning act, by the way. You have to be quite organized
Mm.
to be able to do that.
Mm.
So yeah, definitely if you can, prepare food, help with chores, just to lighten the load in any way, will make a big difference.
Mm.
Yeah.
Okay. All right. So that's on the one hand. And then the other hand is, so that's your friend. But other hand is you yourself are feeling a certain way, or you yourself want support. Then what can you expect from your family members who may not get it, right? Elder family members, they might not get it. Your siblings might not get it. How can you convince them?
First of all, when you're already struggling yourself, it's very hard to try and convince other people and educate other people, you know?
Mm.
So I think you should probably just like remove that from your list of goals. Delete that one.
I mean, that's what we hear. Like, as a young person, you hear something about mental health, you're like, wow, this is perfect for me. This would apply to my life so well. If only my parent understood it, then we could have harmony. That's where that comes from, right?
Yeah. There's always that kind of conflict between like people not getting where you're coming from. And with parents, there's so much emotion there. That relationship is already so like, charged. It's a charged relationship, So, I would just speak kind of matter of fact and quite confidently about my own mental health. It's hard to do when you're feeling depressed and you're already kind of anxious and you're already kind of feeling like your insecurities are magnified. It's not easy to be like, well, no, I really am struggling and it's okay that I'm struggling, and trying to educate and convince people. So really I would just like try not to make that a goal, even though
So that's not, so we're removing that from our expectations that others will understand. We're focusing on our internal expectations of our own self and improving our own self, whether or not other people come to us. We can try to talk to them about it and they might understand, they may not, but to come in with no expectations, that's what you're saying.
I'm saying that
focus on what you can control and not what others.
I'm saying that, be open with your family, talk to them, and I hope you have good relationships and open communication and stuff, and like go for it, try it. But if there is resistance there, then it's not your job. Like relieve yourself of the burden of educating somebody else about mental health. This is huge, And honestly, I would seek support in a therapist. I wouldn't even really go to friends and things at this point because professional help is important. Somebody who's there with zero agenda, third party person who really understands their craft, and is able to like help you sort through things. That organizational ability is huge, and sometimes you just need somebody else to help you out with all the crisscrossed wires in your own mind, Okay. So therapy is honestly what do you think about people coming to the imam? Because I know that happens probably more frequently than
about what?
Looking for a therapist.
About sadness or about depression.
When they're going through it.
I think people come to the imam more for like family counseling. So parents bring their children to the imam for like, hey, my kid's not listening to me. Can you speak some sense to them? Or or couples come because they're not sure. There's confusion around the rights of each other, or they're having a lot of disagreements and they're not sure where to go. So if there's like an Islamic issue, generally speaking, most couples, they don't need an imam. They need a family therapist, someone who does that every single day, someone who does that as a profession, right? But do people come to the imam for sadness or depression? Not as much. I would say not as much. And if they do, I don't really do a whole lot there. I act as a first responder to say, hey, these are some resources that we have. These are some therapists, mental health professionals in the community that you can go to talk to about specific issues that you're having. But a lot of times people are in denial. They're like, nope, I don't need a counselor. I don't want to involve anyone else. I just want Islamic advice. As if the issues of mental health or family health are primarily an Islamic issue. But as you've said, right, and as we understand now, that mental health has so many facets. It's not just Islam, and spirituality is one part, perhaps, that can be a supporting factor, but it's not the only thing. There's so many things. that relate into mental health, solving for it, taking action on it, and so on.
I guess as well, people kind of trust their imam, and they're kind of wanting to contain the issue by like just talking to the imam, and the more people I talk to, this therapist, and I don't want to be airing my dirty laundry, and I don't know this person is a stranger, and this and that. I mean, personally, on a personal level, I feel much more comfortable airing my dirty laundry to a stranger than to the imam who I see every week at Jummah, I mean, it's fine. I think there's definitely a role there and value there. People value their spiritual leaders, and I think that's important. But there is a bit of a line that gets blurred about whether it's appropriate.
Yeah, I think, like I said, seeking cure is something that we do in Islam from the people who can cure it. Right, that's number one. And
from the people who can cure it.
Yeah, there you go.
I like that.
And then the second thing is that it's okay to reach out to people. It's okay to have support. The Prophet ﷺ, he had his companions, the Sahaba. They're literally his companions. He couldn't have done his mission without them. He was one human being, and with their support, he was able to spread the message of Islam and complete his mission. So, it goes without saying that you need support, and you need to find that support. You need to find your companions. You need to find your social people, whether that's the people that are in your own kind of friends and family, or whether that's going to a therapist and seeking out that support there. Okay. So I think that is it for today. That was a really brilliant time. There was another question about self-trust. How can you increase self-trust? But we will save that question for another time. I think this is a good place to stop for now.
A bunch more questions as well. These were just the top few that
This was just the top of mind kind of things. So we'll get to the other ones next time. So thank you all so much.
And if you guys do have like more follow-up stuff,
feel free.
How can they communicate?
Yeah, feel free to post a comment on this video or on the website, and we'll get to it. Or on the Instagram or wherever you find it, just post a comment and we'll get to it. All right, thanks everyone. We'll see you all later. Assalamu alaikum wa rahmatullahi wa barakatuh.